Hi everyone. So I'm going to do a lecture on OB-GYN surgery. I am in classroom 6, so that's why our lighting is a little different today. But hopefully you don't care about that because you're going to be following along with my slideshow anyways. So I am sitting in front of some of our OB-GYN instrumentation that's laying behind me on the table that you will get to play with hands-on in the classroom. So when you go out to externship, you're more familiar with these instruments. And I think it's easier to remember them, of course, when you've held it in your hand and have an idea of what they're going to use it for. So you'll see that this slideshow has a lot of pictures of instruments. If you're looking for more, trying to find more resources, use my Pinterest page that I've already given to you before to find more pictures like that of instruments. But as I said, you'll have them in the classroom and we'll get to label those just like our major tray. So let's get started. Look in your book. This is chapter 15, and I'm going to start on page 506. So to get started, it does an introduction into OB-GYN surgery. What I want you to do is read through all of this and understand that the OB and the GYN tend to be two separate things. So you have a labor and delivery area of the hospital, but yes, C-sections are done in the operating room. So I will make sure to point out the differences of where these cases will be done for you. But hopefully you already know vaginal births will be done in labor and delivery. So I will point those things out for you, but I want to focus more on the surgery aspect of it. Let's go ahead and look at instrumentation, equipment, and supplies. So I put a variety on this picture because you need to know your instruments, and I'll go over those, and there's pictures in your book, but the equipment you don't see a lot of pictures of, so I want to focus on that. So skip over where it says instrumentation and go to equipment. So it talks about in OB surgery, they're going to have special beds available for the delivery room. So again, that's in labor and delivery, not in the operating room yet. These beds function normally. They accept one or more varieties of stirrups. So I included both on this picture for you. So both of these are stirrups. You need to be familiar with both of the names. So candy canes are shaped like candy canes. They're not labeled for a reason. I want you to remember these images because unfortunately that's how you learn in surgery. They're going to give you a new item, a new instrument, new equipment, tell you what it is. You don't have a notepad on you to write notes on. You have to remember that information. So you'll notice as we go through the slides, certain things are labeled, some things are not. It's for a reason. Some things we expect you to remember. So one more time, and again, we have these in the lab. I will show you. These are candy cane stirrups shaped like candy canes. And these are yellow fins. It actually says it right on the side of these stirrups. So yellow fins and candy cane stirrups. There are alternate names for those, but let's start with that to get started. So that's part of your positioning equipment. So if your patient's in lithotomy, you should know that they're going to need stirrups. And now you know your two options, candy cane or yellow fin stirrups. So I'm talking about that under equipment, even though that section doesn't focus on that part of equipment. It's talking about the beds and laparoscopic surgery and things like that. I need you to focus on this. So that's why I added it in. So equipment, you need to know the two names of your stirrups. After that, let's look at this old device right here. So this is your DNC suction machine. If you open that top drawer, it's got all these different size tips because everybody is shaped differently. So we have different tips to fit the size of the patient to do our DNC, or dilation and curettage. Those usually are going to be suction DNCs, and I'll go over the difference between a DNC and a suction DNC. But if it's a suction DNC, then you will need this suction device. And it usually looks pretty old like this, just like the one in our lab for DNC procedures. So that's another piece of equipment you want to recognize when you see it. So DNC suction machine. Okay, after that, it talks about gynecological surgery requiring a lot of the same abdominal equipment for general surgery. So if you're doing an open belly case, yes, you'll have some of the same instrumentation. You will also have extra GYN specific instruments, and we will learn those this week. After that, you'll see a high percentage of laparoscopic procedures require the ST to be familiar with video, equipment, and insufflators. We've already talked about that in minimally invasive surgery. Hopefully you're realizing that minimally invasive surgery bleeds into lots of different other specialties. So lots of GYN procedures are going to be done laparoscopically. That's what I want you to know out of that paragraph. Okay. Flip it over, and I will get back to this big green box, but for now, flip it over. See where it says patient positioning, draping, or setup. So here it gets a little more involved with my equipment here. So positioning for abdominal cases will be supine. You should already know that, but abdominal cases will be supine just like in general surgery. And then if it's a vaginal and abdominal case, it says combination, vaginal and abdominal case, very common, they will be in lithotomy position. And if you think about those procedures, there's going to be two preps done. So a vaginal prep and an abdominal prep will be done. Okay, after that, read down to the second paragraph. It talks about what type of way you're going to set up the room. So it talks about using no Mayo stand on some of these cases. So that's why I included this picture of a vaginal hysterectomy right here. Everything you need is on the back table, and you would not use a Mayo stand. This is because our patient is going to be up in lithotomy, so up in these stirrups. It's all draped out, of course, but your surgeon will be sitting on a sitting stool, and you're going to pull that back table right up on their back. So this is a little confusing for students because we know our back is not sterile, correct? So because your back is not sterile, you have to remember this is not necessarily a sterile case. We're going to treat it as a sterile case, but if it's all vaginal, that's technically a dirty case. So we're still going to prep the same way. We're still going to treat it as a sterile case and keep everything clean, but you know that this is not a sterile procedure. So for that reason, again, they will be pushing that table right up on the back of the surgeon, and that's because they will be sitting on a sitting stool. You'll still be passing instruments and many times retracting against those legs that are up in lithotomy. So you definitely want to have your muscles out for retracting on vaginal cases. You will definitely need them. There are many times where you're going to have to learn to multitask. So you'll be retracting with your dominant hand and loading suture with your non-dominant hand to pass to the surgeon. Because of that, we want you to work on being ambidextrous. And I will give you some tricks on how to load that suture with your non-dominant hand when you're stuck in an uncomfortable position holding a retractor. So again, that second paragraph, let's look at your book. Second paragraph on page 508, patient positioning draping. So Mayo stand is frequently used for abdominal procedures, but may not be used on vaginal approaches. So that explains what I just told you, why this is a vaginal hysterectomy setup with no Mayo stand. You don't need one. A back table of adequate size is needed to accommodate the required instrumentation without clutter. So it's reminding you that you're going to need a big back table. If you have a very small one in your room for some reason, you need to go trade that out for a bigger one for these vaginal cases only, because you have all this instrumentation and no Mayo stand to share some of the instruments. You need a nice big table to handle all of that. After that, you'll see basic things that you should have in the room, right? Suction devices, that's regular suction. ESU, Bovie, kick bucket, and sitting stools. I already gave you that one. So just think about the position. The surgeon needs to be able to see very well, and the patient is up in lithotomy. So they need to get down to that level where they are working so they can see properly. I skipped over where it says kick buckets. They're going to use kick buckets even more often on these cases because, again, there's no Mayo. There's no place for them to hand you stuff. So they like that kick bucket down below the patient so they can drop those sponges right into the kick bucket. Okay, that is just a little bit of your positioning equipment. So that was for your equipment on page 506 a little bit, and even more on page 508, talking about your positioning equipment and equipment that you're gonna need inside the room. So these are the ones I want you to be able to recognize when you see it. Okay, so that brings me back to instrumentation. So we are gonna flip back for just a moment. So now we can get into instrumentation on page 507. So I want you to just make a couple of notes or highlights as you go through this green box. You need to know all of these instruments, yes, but I want you to tell you what to pay extra attention to. So on the vaginal prep set, many cases you're going to need a vaginal prep set because they want to go in and maybe put in a uterine manipulator, something like this. This is a uterine manipulator, and that acorn that they call it, this black piece that comes off at the end, that allows them to help manipulate the uterus and move it around during the case vaginally so that it's easier to free it up, because you have to be able to move it so that we can free up all the edges all the way around, then make our cuts so we can deliver our specimen out. So things like hysterectomies, you might use a uterine manipulator. This is just one. I'm going to point out so many others. So let me go back to your vaginal prep set. So I talked about your uterine manipulator there for a reason. Some of these trays will have a uterine manipulator. Your book lists Graves vaginal speculum, that's that bivalve duckbill suction, or speculum, excuse me, dressing forceps, sponge forceps, vaginal retractors, Alice forceps, tenaculum forceps, and then your Avard weighted speculum. There it is. So on your right side here, your Avard weighted speculum. This one's very common and you can feel the weight on it. So you want to be familiar with that one. Let me go a little further down. Looking at your cesarean section, on page 507, pay attention to where it says bladder blade from the Balfour. They'll use that bladder blade on C-sections to retract inferiorly as they are getting the baby out on C-section. So this, of course, protects the bladder with this part of the Balfour retractor. Okay, now we can flip back. I did not want to skip that green box. So now we can go to page 509. So it starts going through your instrumentation. These instruments in my slide are not in any particular order. It's just to give you more visuals for these instruments because it's hard to learn off of these black and white pictures in the book, and I realize that. So I want to make it easier for you. So I'll hit again this Avard weighted speculum. So you can look at letter D on page 509, Avard weighted vaginal speculum. So you need to know that one. You really need to know all of these on the page, but I want to make one part easier for you. So on figure 15-1, where it says delivery forceps, I just want you to know them as delivery forceps. So I don't want you to memorize all the different names of slightly different delivery forceps to help get the baby's head out. I just want you to recognize the names. So if you saw those list of names, you would know them as delivery forceps. The most common one, if you want to pick one to focus on, is the DeLee forceps. So that's one that we have that you can learn and hold in your hands in the classroom. So know all of your names for delivery forceps. I've already gone over the Graves vaginal speculum, letter A. That one is also referred to as a duckbill, so make sure you know that. Letter B, your Sims vaginal speculum, and then the double-ended ones, letter C. You should know all of those. You can flip it over, page 510. We have a Goodell uterine dilator here for you to learn with, and also the Sims uterine sound. we go. So I will skip around your pictures a little bit, but you will see Sims uterine sound here. So I want to stop there. Look how I have a plastic one and a metal one. So this is a measuring device so they can measure the cervix, but you want to know it as a metal instrument and know that there's a disposable option. This disposable option, the measurements are a lot easier to read, but you're throwing another piece of plastic in the trash that's unnecessary. So a lot of people like to use the metal one that is inside your tray. But be familiar with Sims uterine sound. After that, we hit all of the dilators. I want you to be familiar with all of those. So letter D, your Hagar uterine dilators. So I've got Hagar dilators on this slide for you also. Note the difference between the Hagar and the Hank. That's why I put them right next to each other. One has a nice little lip on the side. They curve opposite directions, the Hank. And then the Hagar are more smooth, and you're still going to use both ends of them, but they have a totally different look. So hopefully that will help you memorize this instrument, seeing that small difference. It doesn't have that lip on either side. Okay, after that, letter E, this is your uterine tenaculum. So this one, they will clamp onto the cervix to do their work and help deliver that out if they are taking it out as a specimen. So again, an example is a vaginal hysterectomy. So they will clamp onto that cervix with that tenaculum. Yes, it is very sharp. This one can poke you. And yes, it makes holes into that cervix because they have to really pull on it and manipulate it. So that's a tenaculum, but I want you to also know the double pronged tenaculum. So there are single tooth or pronged tenaculums and double toothed or pronged tenaculums. So this one has 4 prongs, and again, they can use it to grab onto the cervix. It says cervix and uterus. Again, it's all connected. You should know your anatomy, and they're going to use that to help remove it as a specimen vaginally. After that, we hit all of our curettes. Let's see. Oh. So on all of your curettes, I've got lots of different kinds on here for you because you can't really see the tips in these black and white pictures. So for your externship, this is what you want to learn your instruments for. So maybe it doesn't match up with your book perfectly, but that's because I want you to know these instruments. So when you go out to extern, you know what you're talking about, and you can first scrub these cases and do these procedures as the scrub tech. Yes, you'll have a preceptor with you, but the more you know, the more they're going to let you do. So if you know the names of these curettes and it's time for you to do in D and C, you're setting it up, you know all the names, they're going to let you do the procedure instead of just observing the procedure. It's going to make a big difference. So letter F, these are all Sims uterine curettes, so they're just like this one. But I want you to be familiar with other kinds. This Haney curette is used to get endometrial lining, just like this Thomas. One is very sharp with teeth, and the other one is nice and smooth. So they have different uses for different curettes, and you want to know the names of the ones that I have on your slide here for externship. Okay, after that, you'll see some devers that you already know on the other side of the page. And then look at letter C. So it looks very similar to a bladder blade, but it is a DeLee universal retractor. DeLee retractor. After that, you'll see something that's similar to your Balfour, but it's just for OB-GYN surgery. So letter E is your O'Sullivan-O'Connor abdominal retractor. So it's like the GYN version of a Balfour or Buckwalter. An easy way to remember this one is it looks like a figure of 8 when it is closed. So make sure you know that. So the O'Sullivan-O'Connor retractor is going to look like a figure of 8 when it is closed. And you can actually kind of see that in your outline of the picture in your book. When it's closed down, it looks like an 8. Okay, let me go back one to our uterine manipulator here. So I am not looking at a page in your book for a moment. Not looking at a page in your book. So uterine manipulators. I talked about it a little bit with my first picture of a uterine manipulator. These are more common. They are plastic, they are disposable. Doesn't have that little acorn like the other one I showed you on the end, but it allows us to manipulate that uterus for the surgeon so they can free it up on all sides so it can be removed safely. That's what this uterine manipulator is used for. So now you're going to hit some more retractors in your book. So on page 512, you should know all of these instruments. Look at letter B. Your Haney needle driver is always going to be curved. So I will show you how to load suture specifically for GYN surgery, but you'll never use a straight needle driver on vaginal cases. It's always going to be a curved needle driver. So know that as a Haney needle driver. The next one you should pay attention to are your Jorgensen scissors, because these are specific for GYN, very sharp. After that, let's look at letter F. So this one is a Haney clamp. So the Haney clamp specifically has an extra tooth down at the edge. Make sure you pay attention to that Haney hysterectomy clamp. After that, look at letter G, your Haney-Ballantine hysterectomy clamp. Slightly different. Note the differences in serrations. After that, you should know your Kelly tissue forceps because that one is specific to GYN also. On the forceps, you have already learned letter K. That's your Ferris-Smith forceps. I want you to also know letter J now. Very similar, slight difference in the handle. These are Bonney forceps, very common in GYN. Okay. So again, I will get all these instruments for you in the classroom for you to hold in your hands. Let's just do a little bit on the terms so you can start studying that before we get into the procedures next week. So 514, top of the page, common features in obstetric examination. So on obstetric history, I need you to know the term gravida. I need you to know that term. So if you didn't already find it in your book, that's the number of times a woman is given birth. So you do need to know that based off of their history, and they usually have that up on the whiteboard if you are in the labor and delivery room. So they'll have how many miscarriages they've had, if they've ever had an abortion, anything like that. Any of that is medical history they need to know at the time of labor and delivery. So it's going to be up on the board. So previous children, whether they are alive or not, all of that information is up on the board, and that's very private information. So you want to make sure to use your HIPAA that you already know about and keep that information private. After that, let's look at key terms in labor and delivery. Honestly, you need to know all of these. You need to know all the key terms. So I added a couple pictures for you. So when it talks about effaced and dilated, sometimes that's difficult to understand if you haven't been in labor and delivery. So I added some pictures for you so you can see. So when they talk about being effaced, you can see at the end when the baby's ready to be delivered, when it's 10 centimeters dilated, they are fully effaced. So make sure you know those terms as you read through it. Let's look at extension rotation. Find where it says extension rotation. So they might have to go in and rotate the baby manually. I want you to know what the head is going to pass over. So rotation of the fetal head back to its original position as the head passes over the perineum. So your perineum, you should know your anatomy. That's between the posterior vaginal opening and the anus. So that's where we have those tears happen, and you need to know all the different degrees of the tears for these patients. Okay, and now I'm on page 515. So here I want you to look at the different lacerations and where it talks about episiotomy. So on perineal lacerations, I added some images for you. So if what it says in the book doesn't make sense to you, maybe the images will help you better understand it. So an episiotomy is an intentional surgical incision. That's the part I want you to know. Intentional surgical incision. This is going to ease the birthing process. It's going to help the baby come out easier. So we're making an incision into the perineum. Find under that picture of the lithotomy position on page 515, that paragraph underneath it, the last sentence, the most common surgical intervention in vaginal birth is the episiotomy and repair of these lacerations. Okay, let's hit the degrees. So on page 516, you need to know all of these degrees. So example, first degree, don't let the way it's worded confuse you. That means it's just perineal skin. So very superficial, just skin. Second degree is when it gets into that submucosa of the perineum. So it's a little bit deeper. It might involve muscle, it might not. So second degree is when it gets into that perineum, the submucosa. So it's deeper. First degree, just skin. Third degree involves the anal sphincter. Fourth degree involves rectal mucosa. So again, if you need a visual, I put some visuals on here for you. So you can see those different lacerations because you will need to know them. Okay. That looks good. Let's move on. Schroeder's procedure. So even though this is technically a procedure, I'm not going to get into the real surgery until the next lecture. So this is the only one I will hit. So this is about an incompetent cervix. So right under where it says incompetent cervix on 516, make sure you read that and you understand. So a woman with an incompetent cervix is at high risk for delivering prematurely. So that is why we might want to do this Schroeder's procedure. So Schroeder's procedure, make sure you read through it, but it's treatment for cervical cerclage, and we're going to place a purse string suture around the cervix. Now it even tells you the specific type of suture, Merceline. So we're going to use Merceline suture for this, so you can add in that note while reading through this procedure. So on the Schroeder's procedure, find where it says paired ligaments. Paired ligaments that extend to the pelvic walls to suspend the uterus are the broad, cardinal, round, and uterosacral. Note that the Cooper's ligament is not in there. So as you're reading through the anatomy, know the paired ligaments that extend to the pelvic walls that help suspend the uterus. It's wanting you to know the ligaments that suspend the uterus because it's not just floating in our bodies, right? It has to be suspended by some way. So these ligaments help suspend it. Again, that is the broad, the cardinal, the round, uterosacral. Okay, so after anatomy, go 2 bullet points after that. First thing it says is cervical cerclage. This is actually your last bullet point on page 517. So this is performed late in the second trimester or early third trimester to prevent spontaneous abortion due to an incompetent cervix. So we are preventing a spontaneous abortion by doing this cervical cerclage. That's why we're putting the suture in. Okay, so I don't have more to add to that procedure. I want you to look at this picture underneath though. I want you to study that picture and remember your anatomy. Find where it says adnexa. Adnexa. So it should describe this in your blue book, your older book, but I want to point this out for you. So the adnexa includes the fallopian tubes, the ovaries, and the infundibulum. So all 3 of those things are included in the adnexa. So fallopian tubes, ovaries, infundibulum. So I want you guys to read through the rest of this procedure for this Schroeder's procedure, but I want you to pay attention to the anatomy on page 517, because that will help prepare you for the rest of this chapter. So I will wait on C-section and the rest of this chapter for next week. But again, I'm going to have all the instruments for you to hold in your hands and learn so you're prepared for GYN surgery. You do a lot of GYN surgery as a scrub tech, so you want to be prepared and be really familiar with these instruments. I would definitely place it number 2 under general surgery. You're going to do the most general surgery, but second is probably GYN surgery. And this is not C-sections, that's OB-GYN, remember. So vaginal procedures where you are very hands-on and up close with that patient in that position. So make sure that you are okay with that. You are mentally prepared for that. So I urge you to get on my YouTube channel and watch some GYN surgeries. And please use your Jomi account to watch some vaginal procedures also, so that you're mentally prepared when you walk into that room to see a patient naked up in lithotomy, because unfortunately that's how we are in surgery. As soon as we go to sleep, our patient is naked and vulnerable. Especially in GYN surgery, they're very vulnerable. So we want to make sure that you have integrity, you respect HIPAA, and you respect our patients. We want to make sure that you care and want to give them the best care and privacy possible. So just keep that in mind, read through everything, and please send me any questions that you have. I'd be happy to answer any specific questions about the material. Okay, that's all for today. I will see you guys next week and go over the rest of OB and GYN surgery. Thanks, guys.